Thank you very much. I'm really privileged and greatly honored that I stand here before you, not to represent myself, but to represent you, the wonderful champions that we have around this table. The champions, my fellow awardee today, the champions from last year, from the year before, and from the year before that, and the representatives of the champions who live the malaria vision and who fight for the attainment of that vision every single day, the ambassadors of the African countries and other developing countries who are here with us this morning. In the 1 hour that we'll be here this morning, between 80 and 90 children under the age of 5 are going to die from malaria, just within this hour. If we had, I think 2 years ago, we would have been saying close to 120 children would be dying. We want to be able to stand here in 2015 or at the beginning of 2016 and say 0 children have died from malaria. The fight against malaria has been a meeting point for every single committed development worker and development partner. But it is also a meeting point of the economic growth and development vision of our developing countries, particularly on the African continent. Africans lose a lot of productive capacity to malaria. Last year, we lost 650,000 people, much less than the million that we lost, I would say, 3 to 4 years ago. But we still lost up to 12 billion in direct costs to malaria, and between 30 and 40 billion in both direct and indirect costs. Families were not able to feed themselves because during the malaria season, that is the time when families have to go out into the fields and plow and produce food for themselves. And that is when they are down with malaria, a very debilitating disease. We have seen children's performance at school gradually improve because of what you are doing. You, the champions, the fighters against malaria, who are supporting that mother who has lost the child in the last 40 seconds and the one who is going to lose the child in the next 40 seconds. Because of your efforts and the efforts of the global community and the leadership, first of all, of that mother in her family, of the community leaders, of the heads of state who want to be able to demonstrate that human development is more than just the absence of ill health, but it is about creating opportunities for growth and development and self-actualization, which can only be attained without ill health. We want to be able to say to the global community, as Africans, that yes, you are supporting us. Yes, our vision and our mission belongs to the world. But we own this battle. And that is why ALMA exists. Under the leadership of His Excellency President Kikwete, Jakaya Mrisho Kikwete, of the United Republic of Tanzania, and the leadership of President Ellen Johnson Sirleaf of the Republic of Liberia, and the leadership of every single ARMA head of state. We want to be able to work with you as partners to deliver on our common vision. Last year alone, in just one single year, you, the global community, have committed new resources of 1.8 billion to malaria. No one would have dreamed that this was even remotely possible 5 years ago, 10 years ago. With your leadership and your commitment, last year we were able to deliver in just one single year nearly 140 million long-lasting insecticide nets that have saved mothers and children from morbidity and death. In 1 year. This is unprecedented. We have seen between 2005 and the end of last year, over 800% increase in indoor residual spraying. This is a sign of commitment, a sign of ownership of the challenge. We have a long way to go. As I told you, in 2015, we want 0 deaths from malaria. We have to come up with innovative solutions. And I would like to thank every single partner who is here today and who is not here today, who have helped us over the past year to live our vision and our mission. We have come up with innovative solutions, not just the ones that we have worked on for many years, that like the Affordable Medicine Facility for Malaria, which we are still trying to introduce effectively. But we have come up with new solutions on procurement. Last year, working with UNICEF, with the World Bank, and with the ARMA countries, we were able to accelerate procurement of 24 million nets for 6 countries that were able to achieve, cut down the procurement period from 9 to 18 months to 3 months and less, through the utilization of an innovative mechanism in bulk purchasing. This is the type of innovation that is required. We want innovations that will enable us to get rid of the stockouts, the best practices in stockouts in countries, and scale them up. Robust distribution chains in countries. Technical support that combines the technical know-how of all our partners. Last year, ARMA was very, very proud to work with our partners from the Global Fund, from PMI, from the World Bank, from WHO, from Rollback Malaria, from the Gates Foundation, to ensure that robust project proposals are submitted to the Global Fund for funding, and to ensure that when resources become available, there's accountability for the use of resources, there's a focus on results, a focus on outcomes, and that we hear less and less about stories of misuse or diversion of funds that come from you, the taxpayer, and come from the people that some of you here in this room represent. To take this further, ARMA has introduced an accountability mechanism that ensures that there is a full monitoring of what happens to the money when it gets into an African country. If you have been given 20 million for long-lasting insecticide-treated nets, for IRS, for ACTs, what is the progress that you are making? The heads of state have committed to adopting a scorecard mechanism which enables them to monitor themselves and each other to ensure that they are using these resources in the manner in which they are supposed to be used, and that these resources are buying results and saving lives on the African continent. We introduced the scorecard mechanism this year, and we are grateful for those of you are around the room and globally who are working with us to make sure that this accountability mechanism, which holds heads of state and partners in country accountable for results, works effectively. This is how we want to live our vision. And this is how we want you to be able to be confident to go to the American taxpayer and say to the taxpayer, your money has saved 650,000 under 5 children in Africa. Because this is the report that ALMA would like to commit to making to you in 2015. But we can only make this commitment with your support, which is why I'm really privileged to receive this award on behalf of the true visionaries behind ALMA. His Excellency President Jakam Kikwete, our beloved leader and champion in the fight against malaria globally, Ambassador Ray Chambers, and all the committed workers that work under the ALMA umbrella, under the UN Special Envoy's umbrella, under the government of the United Republic of Tanzania, and the ambassadors of Africa, who are the steering group of ALMA, the champions that work under PMI, under USAID, that work under WHO, under the World Bank, under RBM, under the Gates Foundation, that work for Malaria No More, who advocate so strongly for this war and this battle, and who has demonstrated how it can be won. I would like to accept and to appreciate the recognition that we are giving these champions, because these are the true visionaries behind this mission. And I would like to commit once again to the living of this vision and this mission together with you. Thank you.